So for today's settings, video setting. So good day. Good day, ma'am. I am Mala Choi E. Leite, a second-year nursing student at Notre Dame of Tacloban College, College of Nursing. So for today, I'm going to perform my return demo about bag technique. So what is bag technique? So bag technique definition, it is a total making use of public health bag through which the nurse, during his or her home visit, can perform nursing procedures with the ease and less time and effort, and renders effective nursing care. So what is the purpose of bag technique? So the purpose of bag technique is to render effective nursing care to clients and or members of the family during home visit. So contents of bag and its arrangement. So nandito na ang lahat ng equipment sa loob ng bag. So, wala namang specific na arrangement kung saan lang komportable ang nurse at easy to access. So, note, blood pressure apparatus and stethoscope are carried separately. Package containing a sterile drape, sterile equipment as needed, and wrap sterile goods, and as an antiseptic solution. So let's proceed in procedure and rationale. First, upon arriving at the client's home, place the bag on the table or any flat surface lined with the paper lining, clean side out, and put the bag's handle or strap beneath the bag. So rationale, this is to protect the bag from getting contaminated. Good day, ma'am. So, ma'am, ari ko di subong, ma'am, para urine test para sa inyong sugar and albumin. So, okay lang po ba, ma'am? Opo. Thank you po, ma'am. So, ma'am, pwede po bang ang lamesa nyo gamitin para lagyan ng mga kagamitan? Okay lang po ba sa inyo, ma'am? Opo. Okay po, ma'am. Thank you po. So by placing the lineman, it should be away from your uniform. So put the bag. So second procedure. Ask for basin of water and a glass of water if the faucet is not available, and place this outside the working area. So, ma'am, pwede po ba palanggana na may tubig para gamitin sa panghugas? Okay na po ba, ma'am? Okay, ma'am. Thank you po. So rationale, this is to be used for hand washing and to protect the field from being wet. So, ay, dito na. And third is, open the bag, take the linen and plastic lining and spread over the work and field area, the clean side out. So rationale, this is to make a non-contaminated work field. So and so next procedure, take out hand towel, soap. Take out the hand towel, soap, the apron. Take out the hand towel, soap dish, and apron and place them at the one corner of the area. Rationale, this is to prepare for hand washing. So, number 5, do hand washing. Wipe dry with towel and leave the plastic wrappers of the bag of the towel in the soap dish in the bag. Rationale, to prevent possible infection from the provider to the client. And after doing hand washing, just dry your hand with hand towel. So let us assume that there is a water and I'm doing hand washing. So we're done. So number 6, put on apron right side out and wrong side with the crease touching the body, sliding it to the neck strap and neatly tie the strap at the back. Rationale, to protect the nurse uniform and keeping the place create aesthetic appearance. So next procedure is put out things most needed for the specific case. Example like thermometer, kidney basin, waste paper bag, and place at one corner of the work area. So, this is the, mix bag. So, next is, no. Rationality is to make easy to get, and preparing the equipment is easy to um, 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 to make readily available. Number 8, place waste paper bag outside of the area. Rationale, this is to prevent the contamination of the clean area. And number 9, close the bag. Rationale is to prevent the contamination of the bag and its content. So, next procedure is proceed into the specific nursing care or treatment. Rationale is to give comfort and security to make sure maintain personal hygiene. And after that, we're going to proceed in urine test albumin. First, cleans and assembles all articles and equipments needed. Rationale, this is to prepare, no. Second pala yun. Second, prepare 3 or more cotton balls with denatured alcohol or alcohol lamp. Third, fills the test tube 2/3 of urine. Note, urine specimen should have been collected early in the morning before breakfast. Fourth, heats the upper portion only of the test tube with urine without shaking. Compares the heated to the unheated portion for changes. And 5, read and interprets result correctly. So, if there is no change on the heated portion, the result is negative. So, if negative, acetic acid is not added. But next is if the duddiness appears, add 5 drops of acetic acid to the urine. Next is heats again to the roll out presence of phosphate. Note if cloudiness disappears, result will still negative. But if it persists in spite of addition of acetic acid or even depends, the result is positive. So, next is after the urine test, discard things appropriately, put in the waste paper bag. So, next is explain correctly and comprehensively to the client or caregiver the result and interpretation of the test. Next is urine test for sugar. So, first is measure 5 ml of Benedict solution in the medicine glass. Second, holding the test tube with the holder and heat it over a spirit lamp till the Benedict soil boils without overflowing. Third, drop 8 to 10 drops of urine into the boiling Benedict solution. Number 4, after again boiling the mixture, let it cool down. And after that, while cooling the mixtures, while cooling the mixture change colors. Next procedure. The color of the mixture serve as a guide to the amount of sugar in the urine. After that, read and interprets the result. So, if the color is blue, the sugar is absent. And if the color is green, it has 0.5% of sugar. And if the color is yellow, there is 1% of sugar. And if the color is orange, if the color is orange, it has 1.5% of sugar. And lastly, if the color is bright red, it has 2% of sugar. So after the urine test, discard the things you use and put it in the discard the things used appropriately and put it in the linen bag. Next is explain correctly and comprehensively to the client or caregiver the result and interpretation of the test. Number 10, after completing nursing care or treatment, clean and alcoholize the things you use. And next is do the hand washing again. This is to prevent the contaminated and prevent the microorganism in your hands. Number 12, open the bag and put back all the articles in their proper places. And next is remove apron folding away from the body with soiled side folded inwards and inside out. Place it in the bag. Next is fold the linen and plastic lining and clean and place it in the bag and close the bag. And when cleaning the linen, your body should be away in the contaminated area. So after that, make a post-visit or conference on matters relevant to the healthcare and taking anecdotal preparatory to final reporting. Um, make appointment for the next visit and taking note for of the purpose. And lastly, see to it that the waste receptacle and its content are properly disposed or before leaving the home. So that's all. Thank you.